Hello, my name is Raj Bhopal. I'm Professor of Public Health at the University of Edinburgh, and I consider myself to be a public health epidemiologist. So let's start with a few simple questions that epidemiologists tend to ask. And I'm going to relate this to Covid-19 pandemic. Firstly, we're hearing that America has got a lot of Covid-19 and a lot of deaths. Is that really true compared with other countries? They've certainly got the most cases, but really that's not comparing like with like. America's a big country with a huge population. The UK's only got about a sixth of the population of the United States. So how do we compare like with like? Well, the simplest thing to do is just to take the population of the United States and the population of the UK, look at the number of deaths, compare it to the population and calculate that as a percentage of the entire population. If we did that, we'll actually find that America has got a lower proportion of Covid-19 deaths than the UK. Let's take another question. In China, the mortality, the death rate for people who had Covid-19 was about 1%. So can we expect the same in other countries, for example, Italy or Spain or the UK or the United States? Well, the answer is no. Why is that? Because China has got a relatively young population, whereas the other countries have got a relatively old population on average. And this disease affects older people far more than it affects young people. So we cannot expect a 1% mortality in other countries. So what can we expect? Well, to answer that question, we would have to look at the data in China by age group and then compare that to the age groups in other countries and do a calculation using a method we call direct standardization in epidemiology. Let's take a third question. How does the rate of infection and the rate of death compare in older and younger age groups? Well, we all know that older people have far more of this and are far more likely to die. But how do we work out precisely what it is? Well, the answer is we look at age groups. So we might look at 0 to 5-year-olds, 5 to 9-year-olds, etc. And we can go on right up to 80 to 85 and etc. or maybe even 90 plus. That's what we call age-specific analysis. And it's very rarely reported, but it's very surprising what you find. This disease is very mild in children, far less mild than flu, whereas it's very severe in older people, far more severe than flu. We also know that males and females seem to react differently. So how do we actually specify or clarify or quantify the differences? Well, we have to use what we call age and sex specific rates. So we analyze the data separately for males and females, and indeed in most countries that is true. Males have more than females for reasons we don't fully understand. And my final question is a much more complex one. People are saying that some ethnic and racial minority groups have got more of this disease and more side effects and more fatalities than other ethnic groups. Well, that's a very difficult question to answer. The first thing we need to have is accurate information on the number of, let's say, deaths and the number of people from that particular ethnic group in the population itself, so we can calculate a rate. Let's imagine we did do that. Then we would have to ask ourselves, could there be age differences in these populations? So we would have to adjust the data for age. Let's say we still found there was a difference, then we come to explanations. What could be the explanation? Is it social and economic factors? Is it where they live? Do they live in the inner city where there's more of this disease? Is it something to do with lifestyle? Is it smoking? Is it other respiratory diseases? Is it heart disease or diabetes? Well, we would have to collect the information in relation to all these potential explanations, and we would have to do some formal epidemiological studies where we take into account all these factors and see if there still is a difference. That means that we would have demonstrated that there is a difference and we would have some potential explanations for that difference. It doesn't get away from the fact that some ethnic or racial minority groups have got more or less of this disease, but it begins to give us some understanding of why that might be the case. So these very simple principles I'm telling you about, they are at the heart of epidemiology, which is the science which studies the pattern of diseases in populations and tries to explain such patterns, and from some such explanations derive understanding of the causes of the diseases. Epidemiology is not a self-evident discipline, but it's a lot of fun and it's very challenging. I urge you to study it.